Nail ridges are those subtle lines or grooves that run along the surface of your nails. But did you know that nail ridges are often a result of an underlying health condition or deficiency? Unfortunately, most people are unaware of this and only view nail ridges as a minor cosmetic issue. What they are ignorant of is that understanding what your nail ridges mean can help in the early diagnosis and treatment of numerous underlying conditions. These tiny ridges can act as a window into your body's internal state, making it worth paying attention to what they might be trying to tell you. This is why in this video, we will reveal to you everything you need to know about nail ridges and the silent warning signs they are trying to tell you. Now, without any further ado, let's get to it. Number 1. Vertical ridges. Vertical or longitudinal ridges are ridges that run from the cuticle to the tip of the nail. You probably have them right now. Before you panic, you should know that vertical ridges are normal and common. You see, as you age, the production of natural oils and moisture in the nail decreases. This leads to the drying out of the nails, causing ridges to form, and in this case they are harmless. A study published in Journal of the American Academy of Dermatology found that vertical ridges become more common with advancing age, with up to 50% of individuals over 50 years showing some form of longitudinal ridging. However, these same vertical ridges can also indicate the presence of an underlying health issue. If you suffer from deficiencies such as biotin, magnesium, zinc, and iron deficiencies, you can have abnormal vertical ridges. The mechanism varies according to each deficiency. In iron deficiency anemia, for example, your nails receive less oxygen, which causes vertical ridges to form. This is because iron is needed for the production of oxygen transporting hemoglobin in your red blood cells. Without iron, less hemoglobin is formed and so less oxygen is transported to the nails. On the other hand, vitamin B deficiency, especially vitamins B12 and B9, can also cause pathological vertical ridges on the nails. This is because these vitamins play a vital role in cell growth and repair. A deficiency in them can slow down the regeneration of the nail, leading to ridges. In a review published in The Lancet, the researchers found that vertical ridges were a common feature among patients with iron deficiency, with about 20 to 30% of anemic patients showing these ridges. Another cause of this type of nail ridges is physical trauma to the nail bed, where vertical ridges are consistently observed in nails following trauma, with the ridges corresponding to the site and severity of the injury. Furthermore, vertical ridges have been linked to autoimmune diseases such as rheumatoid arthritis. In 2004, a study published in Rheumatology International explored the dermatologic manifestations of rheumatoid arthritis. It was found that 40% of patients with rheumatoid arthritis had vertical ridges. Number 2. Horizontal ridges. Horizontal ridges are also called Bou's lines. This type of nail ridges is more concerning than vertical ridges as they may indicate a disruption in the normal nail growth. Horizontal ridges can be attributed to a wide variety of factors, most of which pose a serious threat to health. For instance, when the body undergoes severe stress, such as high fever, infection, or surgery, nail growth can temporarily cease or slow down significantly. This interruption in growth results in the formation of a horizontal ridge across the nail. The depth and prominence of Bou's lines can indicate the severity and duration of the underlying condition. A review in the American Journal of Medicine discussed nail changes due to acute systemic illnesses. Case studies of patients recovering from severe illnesses or surgery were reviewed. It was revealed that Bou's lines typically appear 1 to 2 months after the onset of the acute illness, with the severity of the ridges reflecting the severity of the illness. Moreover, like vertical ridges, horizontal ridges can also be a result of a nutritional deficiency in essential vitamins and minerals. In this case, the nails will only grow normally again once the nutritional deficiency is corrected. Adding to that, common chronic systemic diseases, such as diabetes and heart and blood vessel condition, can be a cause. Diabetes, more specifically uncontrolled diabetes, is known for impairing the blood supply of the extremities of the body, including the nails. This disruption can cause Bowes lines to form as the nail growth is temporarily halted. Similarly, conditions like peripheral artery disease affect the blood circulation too, which can lead to insufficient blood supply to the nail. Number 3. Nail pitting. Pitting is characterized by small, pinpoint depressions in the nails and is usually linked to dermatological conditions, one of which is psoriasis. Psoriasis is a chronic skin condition that affects the skin and nails. In psoriasis, the nail becomes inflamed, disrupting the normal nail growth pattern and leading to pitting. A study in the Journal of the American Academy of Dermatology, carried in 2003, investigated nail changes in patients with psoriasis. The study involved 200 patients with varying degrees of psoriasis. After the analysis of the documented data, nail pitting was found in 70% of patients with psoriasis, with the number and depth of pits correlating with the severity of the disease. Patients of alopecia areata can also experience nail pitting. This autoimmune disorder, where the immune system attacks hair follicles, however, the nails can also be affected and acquire a pitted appearance. Even though the exact mechanism is not fully understood, however, research published in the British Journal of Dermatology in 2005 found a correlation between nail pitting and alopecia areata. This study followed 100 patients with alopecia areata, noting any nail abnormalities, including pitting. According to the results, nail pitting was observed in 50% of patients, particularly in those with more extensive hair loss. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Koilonychia. Koilonychia is a condition where the nails become abnormally thin and flat or even concave. The nail is described as spoon-shaped. Like vertical ridges, koilonychia can also manifest owing to iron deficiency anemia. If we take a quick look at a study published in the Journal of Clinical Investigation in 2004, we will find that there is a link between iron deficiency anemia and nail changes. The results state that koilonychia was observed in 30% of patients with severe iron deficiency anemia. But low iron levels aren't the only cause for this abnormal nail appearance. Koilonychia can also be a sign of low thyroid hormone levels, which can lead to changes in the nail's shape and thickness. According to a 2007 study, koilonychia was found in 20% of patients with low thyroid hormone levels. An explanation for this is that the thyroid hormone is vital for the conduction of most chemical reactions of the body, including those that occur in the nails. As the levels of this essential hormone decrease, these processes become disrupted and disrupt the nail along with them. Additionally, reduced blood circulation because of chronic heart disease can cause the nails to become spoon-shaped due to inadequate nutrient supply. Number 5. Terry's nails. Terry's nails is a term used to describe the whitish appearance of the majority of the nail with a characteristic narrow pink or brown band at the tip. In conditions like cirrhosis, where the liver can't function properly, the nail bed undergoes changes. This is attributed to alterations in blood flow and protein metabolism as a consequence of cirrhosis, leading to the appearance of Terry's nails. When the presence of Terry's nails was observed in 300 patients with varying degrees of liver disease, it was found that 80% of those who had advanced cirrhosis exhibited Terry's nails. This suggests a strong association between liver dysfunction and this nail change. Not only do Terry's nails indicate liver disease, but they can also point to kidney disease. Chronic kidney disease can cause an increase in nitrogenous waste products in the blood. These harmful waste products can affect the nail bed when they accumulate and lead to Terry's nails. In fact, around 40% of patients with advanced kidney failure had Terry's nails, according to a 2008 study. So, these were the top silent warning signs your nails' ridges are desperately trying to tell you. Now, we want to hear from you. Did you or anyone you know experience any of these signs? If so, What was the causative underlying health condition? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.